complete story, an informathon about a national health problem and its control, with reports from Atlanta, Seattle, Birmingham, Alabama, and Los Angeles. Plus, live satellite interviews with leading medical experts across the country, featuring as your hosts, Joseph Benty and Glenda Weena. Now, Joseph Benty.
There's a popular misconception about herpes that we would like to clear up right off the bat. It's that genital herpes is a ravaging disease, invariably leaving its victims anguished and isolated.
The fact is that genital herpes can be painful and distressing, but for most people, it is not a serious problem. In adults, for example, it is not life-threatening. The outbreaks are now treatable. In time, they often improve or just go away. And with a few adjustments, most of the 20 million Americans infected lead normal lives.
Until a few years ago, not many Americans had ever even heard of genital herpes. Then word of an epidemic began to spread. That created near panic, fed in part by inaccurate and sensational reports in the media. On this broadcast, we're going to portray genital herpes for what it is. It's a disease that's caused by a virus. It's transmitted by sexual contact. It's a disease that cannot be cured, technically, but it can be treated.
We're going to set the record straight by talking to people who know about herpes, medical experts who study it, and patients who live with it. We're going to tell you about the entire family of herpes viruses, so common that 90% of us have some type of herpes virus in our system. We also have a toll-free telephone number, your direct and confidential link with herpes experts right here in our studio. That number is 1-800-828-LIFE, L-I-F-E. We'd like you to call if you have a question about herpes. Your conversation with a medical professional will be in strict confidence.
And there's another telephone number that we'll be taking questions to live on the air, which we plan to do from time to time. That's area code 213-664-4981. Either number will give you direct access to our experts, and you can start calling right now.
We'll try to give you an honest and thorough picture of genital herpes. The complete story, as the title of the program implies. In the process, we will puncture a few myths, not the least of which is that herpes is a single disease, and Ken Gale has our first report.
It helps to keep herpes in perspective if we see it for exactly what it is, a family of viruses that cause a number of diseases. And some of the most exotic-sounding viruses trigger some of the most commonplace diseases. Chickenpox from the varicella-zoster virus, for example. And since at least 98% of all American children get chickenpox, it is no exaggeration to say that virtually all of us are infected by a herpes virus of some type during our lifetimes. One, called cytomegalovirus, is very common and usually causes little more than a cold. But in rare cases, a pregnant woman can pass it on to her fetus, and that can result in birth defects. Common mononucleosis is often caused by a herpes called the Epstein-Barr virus. And then there is the innocent-sounding herpes simplex virus, which causes the notorious genital herpes. There are actually two branches of herpes simplex virus. HSV type 1 causes cold sores of the mouth, and it is estimated that nearly everyone is infected with HSV type 1, though only about a third of us actually break out with cold sores. HSV type 2 is the one that commonly causes sores in the genital area, although type 1 can also be transmitted to the genitals. Some of the most advanced research into genital herpes is being done here in Seattle by Dr. Lawrence Corey.
There's no question that 99 and 44/100% of the transmission is due to close contact or sexual activity.
When lesions are present, the patient should not have sex because those lesions are full of virus, and any contact with them can transmit the disease to a susceptible person.
Under the electron microscope, all herpes viruses look very much alike. Cousins, says Dr. Corey. But the important thing they have in common, from our point of view, is that they are forever. Once a herpes virus infects the body, it then lies dormant in the nerve roots permanently. In some, but not all cases, the virus reactivates from time to time, causing recurrent infection. Chickenpox, for example, may come back in old age as shingles. And genital herpes is almost always a recurring disease.
We're really finding that about 80 to 90% will recur. And the median number of recurrences in the first couple of years of having the disease is about 4 per year. And as many as 30 to 40% will actually have very frequent recurrences.
There is much more to be said about herpes, particularly genital herpes. Treatment, for example, there have been some important breakthroughs here in the lab. And there is new information about how it spreads, as well as how widespread it really is. Then, of course, there is much misinformation about the herpes viruses. We'll be talking about those things and more as the Informathon continues. I'm Kenneth Gale for Herpes, The Complete Story.
Thank you, Ken. From time to time in our studio, we're going to be calling on some of this country's leading authorities to expand our discussion of the herpes family. And one of those authorities is Dr. Lawrence Corey of the University of Washington School of Medicine in Seattle, who you saw in Ken's report, and he's joining us now by satellite. Dr. Corey, is the idea that this is a cause for panic, herpes, is that justified?
Well, no. Certainly herpes is a disease of some concern, but it is a disease that the vast majority of people cope with very, very well.
Well, that's a very brief question, and it was meant, I mean, a brief answer was meant to be a brief question just to give our viewers a chance to get used to you, because we're going to be coming back to you periodically through this entire first hour of our broadcast. Thank you, Dr. Corey. A number of times during the program, before we break for commercials, we're going to test your knowledge of herpes viruses by giving you a little quiz. Every time you hear answers given by a few people chosen at random on the street, and then you're going to see the correct answers on your television screen. So join in. Test your herpes IQ. The first question, how do they cure genital herpes?
How do they cure herpes? They don't cure herpes. It's something you're stuck with.
How do they cure herpes? With antibiotics?
I didn't know there was a cure for it.
I understand that it's incurable.
My preference would be to try with vitamins.
For more than 75 years at Burroughs Wellcome, people like Lynn Elwell have committed their time and energy to pharmaceutical research. And Burroughs Wellcome supports that commitment. Most of the company's profits are given back to research aimed at relieving human suffering and disease. At Burroughs Wellcome, dedicated people are providing important new treatments and medications.
What we need to do as a team is to discover innovative new medicines that will have significant benefits for people, and then develop them and provide them to people more rapidly and at a lower cost.
More than 30 years ago, a team of researchers started the search for new ways to fight viruses. The result of their hard work and dedication was the first effective drug for the management of genital herpes. Now, we're continuing to explore treatments for the entire family of herpes viruses. Research, people who care, products that make a difference. The hallmark of Burroughs Wellcome's past and the foundation of our future.
For centuries, diseases like genital herpes were known as venereal diseases. The term sprang from the name of the Greek goddess of love, Venus. But it soon took on an unsavory, unloving connotation. Today, people are more open about sex and are striving to remove stigma from language. So the term venereal disease has largely dropped out of use. Instead, we speak of sexually transmitted diseases. It's a good example of how what we call something reflects our attitude toward it.
One of the persistent myths about genital herpes is that it strikes only those who are sexually promiscuous, people who have loose morals. In fact, more than half of the patients who have genital herpes have monogamous relationships. And as we hear in this report from Sheila Scott, anyone can get herpes.
I've had it for, about 8 years. I have no idea how I got genital herpes.
This is 31-year-old Chris Poirier. She's one of the estimated 20 million Americans who has genital herpes. But she's not just a statistic. She's a college graduate. She aspires to be a writer. She is happily married, and having genital herpes hasn't ruined her life.
I mean, it's not a big deal in my life to have genital herpes. Now, that may be because I'm married, because I have a stable social life.
How did you tell your husband that you had the disease?
I had an outbreak. It was about 6 months into our relationship when we had been dating for about 6 months, and I knew, I usually know about 3 days before I have an actual outbreak, and I knew I was going to have an outbreak, and I said, I have to tell you something, I have herpes. You know, I've had it for a couple of years, and I usually get it about 3 times a year. And it's not a big problem for me, but I definitely don't want you to get it. So I want you to know that I haven't, and we have to take, you know, some kind of precautions.
What precautions are you taking?
Abstinence. I mean, we just don't have relations when I know that I'm going to have an outbreak, and then it's usually a 7 to 10 day period.
But in a married or single relationship, communication with your partner seems to play a major role in managing the disease.
In a married relationship, I mean, definitely talk about it and hope that your partner is receptive and will work with you so that you can just deal with it when it comes up.
Compounding the problem for herpes victims is how other people perceive them.
The impression that that most of society has of people that have herpes is that they've been promiscuous. And I think that's a real myth. You know, I don't think, I mean, I certainly wasn't promiscuous when I was young. I mean, I had some intimate relationships, but I would never have called myself promiscuous.
Some people joke that the difference between herpes and true love is that herpes lasts forever, but the existence of genital herpes can often allow a relationship to be compatible if there's communication with each other and a knowledge of what preventive measures to take to avoid passing it on to your partner. For Lifetime, I'm Sheila Scott reporting.
That's certainly one of the key questions about genital herpes. How can a person infected with it avoid passing it on to a sexual partner? It's a question we'd like to put to our medical advisor for this program, Dr. Yvonne Bryson, Associate Professor of Infectious Diseases at the UCLA School of Medicine, and of course by satellite throughout this hour with Dr. Lawrence Corey. Anytime you feel you want to jump in, Dr. Corey, you're perfectly welcome. Let's start with the obvious. I think every person thinks he or she has, at one time or another, had some kind of a herpes bout. In my case, it's on the upper lip, at least 3 times a year. Is that the same herpes? Am I dealing with the same problem?
No, really there's herpes 1 and herpes 2, and herpes 1, what you're describing, is the common fever blister or cold sore, which most people are infected with.
Now, am I being misinformed when I'm told that if you have sexual relationships at the time you have that fever blister, cold sore, herpes simplex, and let's say you have oral sex, does that mean you are going to transmit the herpes that way?
There is a potential for transmission through a fever blister, which a lot of people don't realize that is herpes. And you can actually get genital herpes with herpes 1 in about 20% of the cases.
Dr. Corey, do you want to add anything to that?
Well, I would just agree with Dr. Bryson that you can transmit herpes, whether it's oral herpes or herpes in the genital area, at the time of active lesions. It's a complicated disease, a disease in which the virus you get from contact, but then it has the ability to remain dormant in your body, and then it intermittently reactivates. And during those intermittent periods of time, that's when one is infectious, whether it's through oral genital sex or through intercourse.
Any of us with the obvious cold sore, fever blister brand of herpes tends to want to touch it because it aches, it cracks, it hurts. And when we do that, aren't we then spreading it?
No, not usually. I think one has to be careful to wash your hands and have good hygiene, etc., but you don't usually spread it in that manner.
Was it at UCLA where the study showed that the herpes virus can live outside the host for a period of time?
Yes, our study and others showed that indeed it could live outside the body, but this is a very unlikely way of contracting it, and I think there's much more concern than reality to that, simply because you need close sexual contact to really be infected with this virus.
There is another herpes virus that you're prepared to tell us about that is somehow related to fatigue?
Well, it's a new syndrome that's described by another member of the herpes virus family called Epstein-Barr virus, the virus that usually causes the common kissing disease or mononucleosis. And there is a new description of a disease which is associated with chronic fatigue and fevers, which we'll hear about more actually in this program.
And these are all transmitted they can be in a similar fashion?
Yes, usually by kissing. Most people will get infected with.
The warmth of the human body, isn't it? It's a perfect test tube, a host.
Really a host for most of the viruses, particularly herpes viruses, yeah.
Thank you. We'll be coming back to you a bit later. And also, thank you, Dr. Corey. Glenda Weena now standing by to tell us what's ahead. Glenda?
All right, Joseph. Up next is a look at America's changing sexual patterns and how they are linked to the genital herpes epidemic. when Herpes, the complete story, continues.
Dr. Ruth Westheimer, I would like to tell you, having herpes certainly doesn't make you be a leper, and it certainly is not the end of your life. I'll have more to say about that subject later on in this important...
Your family is like no other, it needs its own personal approach to health. Family physicians are dedicated to your well-being and want each of you to share information that affects your health. Conditions like high blood pressure may require lifelong medication, but if you can't remember dosages, your doctor may be able to prescribe medicine to take just once a day. So communicate openly with your doctor. America's 60,000 family physicians can help you focus in on health.
Remember, keep breathing deeply. I've got a cold, but it's not stopping me. Sudafed cleared my stuffy nose fast, without drowsiness. Imagine doing that with a cold. A little while ago, my nose was stuffed up, but I got fast relief with Sudafed and no drowsiness.
How fast will Sudafed work for you? Clinical tests show Sudafed begins to unclog nasal congestion in as quick as 22 minutes without drowsiness.
With Sudafed working, I can finish my workout.
Sudafed. Relief begins in 22 minutes without drowsiness.
Historically, little is known about the origins of sexually transmitted herpes. Unlike other diseases traced down through the centuries, genital herpes wasn't even mentioned in formal scientific writings until 1736. That year, a French physician, Jean Astruc, wrote a treatise about a variety of diseases. In it, he referred to so-called ulcers and vesicles found in genital regions. We don't know if Astruc wrote out of direct experience with patients, but if he did, it can be assumed they were people of high station. You see, Dr. Astruc was court physician to the King of France.
Along with the sexual revolution of the 60s came a predictable increase in sexually transmitted diseases, genital herpes included. But in the 80s, we're now witnessing a shift in sexual attitudes in this country, a trend away from one-night stands to caution and commitment. How much of this can be attributed to the fear of genital herpes and other sexually transmitted diseases? Roger Bingham went in search of an answer.
It sometimes seems as if trying to keep up with sexual trends or our shifts in attitude towards morality is like riding an emotional merry-go-round. Think back, it's only 25 years since the oral contraceptive pill was first approved for general use. And for young people particularly, that brought a new kind of freedom and helped start the sexual revolution. You remember those far-away, far-out 60s? But then came the inevitable reaction. Surveys suggested we were missing the intimacy and romance and commitment that seemed to have been washed away in the new wave of casual relationships. Some reports spoke of health hazards from the pill. And then later, along came genital herpes. The one-night stand is now so risky, said Time magazine only a year ago, that a couple interested in casual sex must get to know each other well enough to pop the herpes question and believe the answer. And for many still confused by the myths and misinformation about genital herpes, getting a yes answer was enough to pop the romantic balloon. Of course, when you're in the midst of changes, it's sometimes hard to get perspective. And for that, we should talk to an expert. Carl Fred Broderick is professor of sociology here at the University of Southern California. Dr. Broderick, they tell us the sexual revolution of the 60s is over. Is it?
Well, I think it's all over in the sense that we're not still going up like that and we've leveled off and we've come down a little, but it's not over in the sense that we're back to where we were before it started.
It's said that one of the possible causes is fear of genital herpes. Now, is that true?
Well, how long has it been since you've heard a joke about genital herpes? Years, that's right. I think that was an excuse that people used to give them permission to sort of back away from something they were a little uncomfortable with. You know, people romanticize what total freedom, total sexual freedom would be. Everybody could sleep with everybody. And I think they discovered early on that it missed certain essential vitamins of commitment and meaning. And herpes gave them a good excuse to say, oh, and besides that, I could get this, I'm taking care of my body, I'm backing off.
Who would you say has been more responsible for this return to conservatism, men or women?
Women. women were always more conservative. They went through a period of approximating men, for example, in the number of extramarital affairs and the number of, and the attitude toward premarital sex, toward multiple partners and so on. They've moved back to a more conservative position substantially more rapidly.
Do you hear much about genital herpes these days?
Very little, except that there's sort of an etiquette around it now, that it's not considered very nice to have a relationship with someone if you have herpes and you don't let them know. But it's come to be that. It's a matter of etiquette rather than a matter of panic. I don't hear any panic, no.
So now it seems the counterculture baby boomers have become the yuppies, and the me generation has become the we generation. Above all, people apparently are tired of the merry-go-round approach to sex. It seems they'd rather keep their feet firmly on the ground. For Lifetime, I'm Roger Bingham.
Keeping your feet firmly on the ground, of course, will help you avoid genital herpes, but it isn't any guarantee. Glenda Weena is standing by now with some guests who can tell us why. Glenda?
Thank you, Joseph. We've already met Dr. Yvonne Bryson of UCLA, of course, who is our medical advisor for this program. And now we are joined by Dr. Shirley Fannin, Associate Deputy Director of the Communicable Disease Control for the Los Angeles County Health Department. Delighted to have you here, too. Dr. Fannin, tell me, from your perspective as a public health officer, how big is the genital herpes problem becoming now?
Well, it's very difficult because we do not have a reportable disease. So we haven't established what the level is. I think that it's several things make it appear epidemic. One, less reluctance to talk about the problem, and two, the fact that it probably is more common, particularly among young adults who are more free talking about their sexual problems.
Do you think it will become reportable?
I'm not sure, mainly because there's no easy way to diagnose it specifically. So in poorly diagnosable diseases, reports sometimes don't mean very much.
You know, before we do go to you, Dr. Bryson, and also to Dr. Corey, we have a phone call on the subject. I understand it is from Annette from Long Beach, and she says she hasn't had an outbreak in 7 years. So Annette, talk to us.
Yes, I had an outbreak of herpes diagnosed 7 years ago, and since that time I've never had another outbreak.
Dr. Bryson, would you like to speak to that?
Yes, actually this is one point in case that herpes doesn't necessarily mean that one is going to be having recurrences all the time, and that there's a wide spectrum of disease, and that some people may have only one outbreak and never have another. The only time that it may be important, especially to a woman, is that she tell her doctor when she's pregnant so that she can be followed during pregnancy.
Dr. Corey, have you anything to add to our caller and her question?
Well, I think that it's a complicated issue. Dr. Bryson is exactly right. There's great variability in the disease, and the important thing is for her to notify the obstetrician. With respect to the statistics on herpes, as Dr. Fannin said, it's not a reportable disease. However, there is evidence that a large number of people have asymptomatic infection. And one of the problems that we have is that some of the recurrences are so mild, and there needs to be a wider spectrum and use of diagnostic tests that we can diagnose more people appropriately when they have mild symptoms.
Thank you very, very much, Dr. Corey, and thanks both of you doctors also. And let us go back now to Joseph for a look at what's ahead. Joseph.
Thank you, Glenda. Judging by the way that our telephones are ringing, our viewers have no shortage of questions about herpes. And in a moment, Lifetime's Dr. Linda Reed will be finding out exactly what our callers are asking.
First of all, let's repeat our toll-free number. That's 1-800-828-LIFE. It's your direct line to one of our herpes experts, 1-800-828-LIFE. We'd like you to call if you have a question about herpes, and they're here to give you the answers. Now, let's find out what our viewers are asking. Doctor, if we could ask you to put the caller on hold just for a moment.
Can I put you on hold for just one moment?
Okay. Doctor, what type of calls have you been receiving? What are patients asking?
They're mainly asking how a person goes about establishing a good, firm diagnosis of herpes. The things that I have mentioned is that they should contact their physician to examine the lesions clinically and they can tell that way. A culture can be taken, and a culture can specifically tell if it's herpes type 1 or herpes type 2. And there are blood tests that can tell whether it's herpes type 1 or herpes type 2, new or old. So they're mainly interested in how they can go about establishing a firm diagnosis of herpes, so they'll know for sure.
What type of concerns, worries do they seem to have?
They're concerned about how contagious the disease is, whether they can spread it to their children, whether they can be spread through toys if a neighbor has it. They're concerned about what will happen if they get pregnant, and how a doctor can go about establishing a diagnosis. So they're concerned mainly in terms of contagiousness, and that's the main thing that they're concerned about.
Okay, thank you. There does seem to be a lot of interest about what's going on. We'll be taking more calls as the program continues. A reminder that we will be putting a limited number of calls on the air live. That number, if you'd care to try it, is 213-664-4981. We're going to take a break now, but stay with us. There's much more ahead on Herpes, the complete story.
For the American Academy of Dermatology, Dr. Ronald Reisner. Dr. Reisner, how does a dermatologist go about diagnosing herpes infections?
Most herpes infections involve the skin, and dermatologists, as physicians with specialized training in the diagnosis and treatment of skin diseases, are often called upon to determine whether an eruption is herpes or not. Herpes may involve any part of the skin and may mimic other eruptions such as impetigo and shingles. Accordingly, the physician has to follow a logical series of steps to arrive at the correct diagnosis. Sometimes the history of the eruption and the way it looks is enough to arrive at the correct diagnosis for practical purposes. Other times, specialized laboratory tests such as scrapings and cultures are necessary. In any event, accurate diagnosis is the first important step in the treatment of this troublesome disorder.
Believe me, suffering cold symptoms in one of these, 120 miles in space, with no doctor in sight, it was no picnic. My nose was stuffy, sinuses plugged, I was miserable. So I took Actifed. An Actifed containing triprolidine gave me fast, effective relief. Actifed is the cold tablet that was specified most by doctors for 10 years for relief of nasal congestion, runny nose, and sneezing before being available over the counter. Try Actifed. It's the same strength I used in space. Available to you without a prescription.
If you're looking for advice,
Maybe ask your lover to use a diaphragm. That might be a good solution.
if you want some reassurance,
Is this weird? No, nothing. Let me tell you something. Nothing is weird.
if you need to speak freely,
Don't be bashful. Tell the gynecologist exactly what you told me.
Dr. Ruth can help.
Thank you very much, Teddy, for calling.
Thanks
Good
for
luck.
your open-mindedness, Ruth. We'll all love you.
Thank you. Bye-bye.
Lifetime answers and advice for you.
This program is produced by Lifetime in cooperation with the Centers for Disease Control and is sponsored by Burroughs Welcome Company.
There's no question that genital herpes can be a troublesome disease. Minor physical discomfort, readjustment of sex habits, and maybe a strain on personal relationships. Those are some things that a herpes patient must expect. But there is no need to be fearful that if you get genital herpes, it's going to ruin your life. Another myth that we would like to explode with the help of this report from Robert Dean.
You could say that 35-year-old Gary Bartley is the prototype success story. He's a top sales representative for a major corporation, is happily married to his wife Carol, and owns a comfortable condominium in Southern California. But things weren't always so smooth for Gary, especially 3 years ago when he discovered he had genital herpes.
I made an appointment and went to see my doctor. And he came back in after a visual inspection and said, "Well, Gary, it appears as though you have herpes." And I said, "What?" And he said, "You have herpes." And I thought, uh-oh, you know, I've done something wrong. I literally just broke down and cried. I didn't know what to do. There was no cure for it. You know you have something incurable. Where are you going to go?
Gary wasn't married at the time, and to this day he isn't sure from whom he caught the virus. But the lesions, especially after the first outbreak, were unmistakable and multiple.
5, 6, up to 12, could be 16. They can take up an area half-inch square or greater. Not only is it shocking, but because you are more aware of a large outbreak like that, because of the pain associated with and the duration of time for it to heal, of course you feel even more alienated.
For months, Gary submerged himself in his work and became socially isolated.
To think about telling somebody that I would go out on a date with, I almost was at a point where I didn't want to go out on a date. You know, at first you get interested in somebody, and then as soon as you tell them that you have herpes, Gary, well, then that's it. You know, they're going to walk away. They're going to want to touch you.
Things began to change when Gary met Carol. On their second date, he told her about his outbreaks, honestly and directly. Later, they married.
It's the person that's important in a love relationship. Sexual contact is not everything. Although it plays an important part, the person is more important to me.
Gary also treats his genital herpes with a medication called acyclovir, which helps reduce the severity and duration of the infections. But helping Gary most of all is a new attitude about the disease.
Gary, before you contracted the virus, how did you feel about people who had herpes?
They were outcasts. I didn't have compassion or understanding. I felt that they had contracted the disease, and boy, I didn't want to have anything to do with it. I would not marry anybody who had herpes. I had a very negative attitude about it. And I look back at that now, and that is a very sad stance to take, because this person could have been a very good person, and yet I was so willing to pass a judgment on them without knowledge, and I think that's an important point.
Perhaps one of the most important points when dispelling the myths of herpes. I'm Robert Dean reporting for Herpes, The Complete Story.
Sometimes the symptoms of genital herpes are mimicked by other conditions. So how do you know when you have the real thing? Dr. Lawrence Corey of the University of Washington is standing by again for our last visit with him via satellite. Dr. Corey, could you help us? How do you know when you've really got herpes, genital herpes?
Well, the most characteristic symptoms of genital herpes are a little pain and itching and the characteristic sores or lesions that occur on the genital area. The diversity of this manifestations, however, may vary from person to person. Sometimes there'll be just one small sore. Sometimes there'll be multiple sores.
That's it. The variation depends on the person and the severity of the disease.
Right. First episodes of the disease can be associated with a much longer duration than recurrences of the disease. And someone may have lots of sores. They may even have fever, fatigue, tiredness, headache. That may make someone feel ill for a 2 to 3 week period of time. But then the body develops antibodies to the virus, and then when recurrences occur, they are able to contain the virus more, and hence you just get the local symptoms and signs of pain and itching and the local sores.
Dr. Corey, we have a caller from Dixon, California. Sally, your question for Dr. Corey?
Yes. My question is, I have symptoms before I have an outbreak, and which is my legs ache tremendously, and they're very sensitive to touch against anything, and I just wanted to know if that was normal.
Normal. Did you hear that, Dr. Corey? Her legs
I think I heard that she says that her legs ache just prior to the outbreak. That's very common. If one can think of it as if the virus is dormant in the nerves, and then it sort of reawakens and sort of marches back down the nerves to the skin, and that causes a sort of kind of pain or aching sensation that may occur in the buttock area or in the knee area, and that usually goes away as the blisters occur, and that's very, very common.
Dr. Corey, is it possible some people would be carrying the symptoms of genital herpes and never have any outbreak themselves?
Yes, that's one of the difficulties that we have with the disease. I think every infectious disease, not everybody who gets the infection always gets the disease, and that's the case with herpes. Sometimes it can be gotten in the woman internally in the cervix, and she would not know that there are any visible sores on the outside. But sometimes the episode is so mild that someone really just passes it off as nothing important enough to come to the physician for him to diagnose. And that's the difficulty with it, is this intermittent aspect. When you see the doctor, if he can see the sore or see the symptom and sign at that time, he can diagnose it. But in between times, when the virus is dormant, it becomes very difficult to diagnose.
Okay, thank you. Dr. Lawrence Corey of the University of Washington School of Medicine. And I think in between all of those answers, you should have concluded that if you have any questions at all, consult your physician. Now let's go back to Glenda for another quiz question and a hint of what's to come. Glenda?
Well, Joseph, what is immediately ahead when herpes, the complete story continues, is a conversation with sex counselor Dr. Ruth Westheimer. But first, can you name the different ways people can catch herpes?
Catching it from a toilet seat, I mean, it is possible. But you would have to be in a strange situation to do such a thing.
Is it something like athlete foot? I've heard studies, I guess you can get it from towels.
Maybe from drinking from something that somebody else drank from.
I think only by contact, actual contact, flesh to flesh.
I called to see if you got those reprints I sent you.
I think we got the
Research. People who care. Products that make a difference. The hallmark of Burroughs Wellcome's past and the foundation of our future.
Because your family is like no other, it needs its own personal approach to health. Family physicians are dedicated to your well-being and want each of you to share information that affects your health. Conditions like high blood pressure may require lifelong medication, but if you can't remember dosages, your doctor may be able to prescribe medicine to take just once a day. So communicate openly with your doctor. America's 60,000 family physicians can help you focus in on health.
Our subject is herpes, and here is something important for you to keep in mind. If you think you have symptoms of genital herpes, ask a doctor, a medical doctor, to make the diagnosis. Don't do it yourself. But suppose you learn that you do have herpes, or that your partner has herpes. How do you deal with the sexual relationship? That is a troubling question, and for the answer, we turn not to a medical doctor, but to a sex counselor. Lifetime's Dr. Ruth Westheimer. During a recent interview, I asked if someone with genital herpes should always inform the person they're dating.
One must tell one's partner that one has herpes. Nobody ought to live with a burden of hiding something that eventually is going to be open and in the air. Let's suppose that that couple gets married later. I would rather say that the need is really for openly saying, this is what I have, maybe saying I'm not promiscuous, it's perfectly all right to say that, I don't engage in one-night stands, but I did have a relationship and I did catch herpes.
When is the right time, or is there any special time that you would tell someone you have herpes?
I would say that find a moment. You know, in education we talk very often about a teachable moment. I'm going to say something for this program. Find an askable moment. Find that moment, not in bed, not just before you engage in sexual activity. Don't wait until he has an erection and she is lubricating and really ready to engage in a sexual activity. That's the wrong moment. Do that over dinner, maybe over dessert.
If you could imagine the person who has herpes having to explain it, how would you do it? How would you tell them to explain it?
Honey, I do like you very much, but I have to tell you something, and I'm going to tell you right away, that this might mean that you will not engage in sexual activity with me.
To expect from Billy, and they're playing well under it.
I'm going to be honest and tell you that I do have it. Now you have to make a decision.
Dr. Ruth, if you tell someone at the beginning of a relationship and you think it's going to be a good relationship that you have herpes, aren't you running the risk of ruining that relationship?
Is the relationship strong enough? Is the sexual attraction strong enough? Is the hope for this relationship to be a future relationship strong enough for that other person to say, okay, I will engage with you in sexual activity. If I get it, I get it.
It really doesn't make any difference whether or not we have herpes. I think all of us really owe it to ourselves to find out about herpes, don't we?
I talk about these issues exactly like I'm talking to you right now, but never really enumerating any of the physical symptoms. I leave that up to physicians. We have experts.
A man or woman who is concerned about herpes, I imagine, should consult a physician as soon as possible.
A herpes hotline, I send them to a clinic, to the doctors, to urologists, to the gynecologist. But I, as a sex therapist and as an educator, do not enumerate because I am not a medical doctor.
See, the problem in a delicate area like this is that some of us, if we suspected that we had herpes, would, as we hinted earlier, try to diagnose it ourselves. That is very dangerous. In this, as in many other areas, always consult your physician if you have any suspicion at all that you might have genital herpes. Right now, let's go for a consultation with Glenda Weena. Glenda?
Well, Joseph, so far we have heard from and about people with genital herpes, how it's affected them, what they're doing about it. But what about their mates or sex partners who don't have it? We thought it might be useful to hear from the husband of a woman we met earlier, a woman who contracted genital herpes 8 years ago. It'll shatter the myth that if one partner has genital herpes, the marriage is doomed. Our reporter is Sheila Scott.
It distresses me when I know I'm getting an outbreak. It distresses me because I mean, a little bit, because I know I'm not going to be able to be close to my husband.
Chris Poirier has had genital herpes for about 8 years. Her husband, Len, of 3 years, is a resident physician in radiology. Len and Chris enjoy an active life together, and their relationship is not affected.
As a matter of fact, we generally use that time when she has an outbreak to good use, I think. When she's going to have an outbreak, she tells me. And so we know that for a certain number of days, we aren't going to be able to have intercourse. But that doesn't mean we can't be intimate. We can spend that time talking, lounging around on the couch, which we do quite a bit of. Or even when we wake up in the morning, this may seem silly, petting each other, kissing. We both know that it's not going to lead to intercourse, and that's fine. And in that way, it's almost a more intimate relationship because you know that it can't progress, you aren't in a hurry, and you can just enjoy each other.
I worry about it. I do worry about it, not excessively, because, I mean, we know what to do about it and we do it. But I worry about it because I don't want him to get it, because obviously that's going to cut down on our time together if he ever does get it.
Len, you are career people and obviously very intelligent. Weren't you frightened to go on national television and tell the world that your wife has genital herpes when there is such a stigma attached to it?
I guess there was a little bit of fear, but not that that herpes is anything to be ashamed of. I'm certainly not ashamed of my wife, and I'm not ashamed of our relationship. I think we have a great relationship. We enjoy each other, and herpes just has not played any part in our life. It's the least of our worries, and I want other people to know that.
Do you think you're turned off by the fact that she has herpes?
I've never looked at Chris differently because she has herpes or when she has an outbreak. It doesn't change my opinion of her one way or the other. I love her just the same.
For Herpes, the complete story, I'm Sheila Scott reporting.
We're going to take a break now, but not before we give you another quiz question on herpes. When we come back, we will have reports on useless remedies and effective treatment of genital herpes. First, who who or what is varicella zoster?
Zoster?
It's a symphony orchestra from France.
She was a ladies' second baseman for a championship softball team back in 1967, I believe.
Varicella zoster? Good question. No answer.
The Czechoslovakian ballet star, defected in the 40s.
I'm Robert Dean in Los Angeles. There is no cure for herpes, but there's an effective treatment. We'll tell you about it right after this.
For the American Academy of Dermatology, Dr. Ronald Reisner. Dr. Reisner, what's the difference between skin infections with herpes and shingles?
Well, both herpes and shingles are caused by related viruses and have some features in common which may lead to some confusion. It's important to distinguish between them because their treatment and their outcome is different. Dermatologists, as physicians with specialized training in diseases of the skin, hair, and nails, are often called upon to help make that distinction. Unlike herpes, shingles often occurs in a band-like pattern, and rarely ever is there a second attack. Unfortunately, there is the risk, especially in people over 50, of long-lasting pain after the rash has disappeared. Early diagnosis and treatment can help prevent this. Diagnosis can often be made on clinical grounds, and occasionally special laboratory tests are necessary.
You know, it is a sad fact of medical history that for every disease there's usually a suitcase full of useless remedies, and that's especially true of diseases for which no cure is available. Quackery loves a vacuum, so it's no surprise that genital herpes has drawn its share of snake oil salesmen. But as Russ Nichols reports, quick and easy remedies are just a myth.
I've heard estimates that the quack industry for herpes is roughly $50 to $500 million a year.
You want herpes cures? They've got herpes cures. Miracles, remedies that will supposedly free you tomorrow and forever of the curse of herpes. Curacor, Herpicide, Chinese herb tea, and the ever-popular BHT.
So we're talking about quite a bit of money being invested into things that could be potentially harmful or at best are useless.
One of the champions of BHT is Steve Fouts, affiliated with an organization called Mega Health. He lives and works out of this house in Palo Alto, California, and says he has special knowledge about nutrition and vitamins. He's written a book touting the food preservative BHT as a remedy for herpes.
Many doctors, in fact, most doctors, say that this is just outright quackery. It's fraud.
True. That's true. But that is, all new information is treated that way.
Fouts, who cites no hard scientific evidence that BHT actually works against herpes, has sold thousands of copies of his book by mail order and at health food stores. He's even made somewhat of a religion out of his belief in unusual remedies for various ailments.
Are you a member of the Church of the Tree of Life?
Yes, I am.
Now, what is it that they advocate?
They advocate the sacramental use of various substances.
People suffering from herpes can easily buy BHT powder mail order or from a vitamin store like this one in Mountain View, California, where the proprietor insists his product is not sold as a herpes cure.
Yes, we sell quite a bit of BHT over the years, and we sell it to the people who want to preserve their cooking oil with it.
You didn't know the preservation of cooking oil was a big problem. Well, Jeff Young, director of the store, says it is. Meanwhile, back at the ranch, Steve Fouts is telling us about sacramental substances.
Substances that are used metabolically, are used by the brain to create the substances that your brain cells talk to each other with.
There are many types of therapies, including vitamins, that have been touted as cures or treatments, but unfortunately none of them has held up with the test of time.
Not BHT, not Herpex, lysine, not even 100% volcanic mud. For Lifetime, this is Russ Nichols reporting.
So the point is, don't be hoodwinked by glowing promises. But how does the average person tell a phony remedy from the real thing? That's the question, Joseph.
Right. We'll try to get the answer for you, Glenda. The best answer always, of course, we'll keep repeating it throughout the broadcast, is consult your own physician, a reputable physician, we hope, preferably one who has some experience in treating sexually transmitted diseases. Robert Dean reports now on a medication that for many people with genital herpes may be exactly what the doctor ordered.
Unfortunately, there is no cure for herpes, but there is an effective treatment. It's called acyclovir. For most patients, they can take the capsules or use the cream. For severe first episode cases, acyclovir is sometimes given intravenously, but generally the treatment of choice is the oral capsules.
It is being shown to reduce the severity of this attack from approximately 3 weeks to probably 1 week or less. Reduces the symptoms. It also reduces the amount of time the sores are present and the amount of time the virus is present. So it does make a significant difference for the first time someone gets it.
For patients like Gary Bartley, whom we met earlier in the Informathon, acyclovir is taken during the prodrome, the stage preceding an outbreak. When Gary feels the symptoms coming on, he takes 4 capsules a day for 5 days.
And you can see, at least I've been able to see the results of the drug, where the redness does dissipate. There's no tingling or itching or burning, which means that the virus is not present in the area. If it is starting its recessive point and to go back into its dormant state. Initially, when I started to take the drug and administer it like this, I might have sometimes I could have as many as 12 small lesions. And now it has either no lesions or it has come down to maybe 1 lesion.
While acyclovir has made life easier for both Gary and his wife Carol, they still have to be careful to avoid intimate contact when the virus is active.
When the lesion heals, and that is usually after I've administered all 20 capsules of the drug, I wait maybe 2 or 3 days, and then I might tap Carol on the shoulder.
Gary and I both learn day by day when you have to go through periods of abstinence, and just to be patient and realize that it's a temporary situation and that the person you're married to is a lot more important than just a sexual relationship.
Research has also found that acyclovir, when taken daily, is also effective as suppressive therapy to prevent recurrences of genital herpes. This can help people suffering from severe and frequent outbreaks, say more than 6 episodes a year.
They may take several tablets a day, and studies done on this have shown that when taken every day, it will prevent recurrences in those patients in about 70% of the cases. And in 30%, they will have less severe outbreaks. So that I think this is a significant advance as a control for herpes and a treatment for herpes.
But this long-term use of acyclovir is only recommended for 6 months at a time until the ongoing studies are complete. Finding an actual cure for genital herpes is not quite so promising, but research looking into a vaccine to protect people is, and we'll have a report on that a little later in the show. I'm Robert Dean reporting for Herpes, The Complete Story.
One characteristic of genital herpes is that it usually causes repeated outbreaks of genital sores, but the recurrence may be as frequent as once a month or as infrequent as 2 or 3 times a year. Dr. Jerome Eder is chairman of the perinatal medicine at Humana Hospital, West Hills in Canoga Park, California. He is medical advisor to the Los Angeles Health Program. And Dr. Yvonne Bryson, we've already met. Dr. Eder, what brings on the recurrences of genital herpes symptoms, and do all people who have genital herpes get those recurrences?
In the long run, many people have perhaps only 1 outbreak, and then maybe for the rest of their lives may have no other outbreaks whatsoever. But it's 50-50 in some cases. There are many reasons why outbreaks can come out, and sometimes they're predictable. For instance, we really put stress at the top of the list. However, there are good stresses and bad stresses. For some people, marriage can be a good stress, but still it causes the immune system to change temporarily and may lead to an outbreak.
So calm nature and taking it easy is going to be helpful.
If we could all handle all the stresses in the 80s, I predict that herpes would be a much more minimum problem than it is already.
Now, acyclovir, Dr. Bryson, is that for everybody? Does it help everybody?
No, it's not for everybody, but I think it will offer, used in different ways, an option for people to control the outbreak. Used either intermittently when they have recurrences, or for a small subsegment of the population, is taken every day to help prevent outbreaks.
And don't go looking for white pills. Those were experimental.
Right, they're blue.
We have a caller who wants to ask a question that I'm sure disturbs many women who are suffering from herpes, and of course men who are sympathetic to a woman's plight, which is quite different from a man, and that's the danger to their cervix. And we have a caller in Texas. Would you ask one of our experts your question, please?
What is the relationship of cervical cancer to the genital herpes?
Yes, the relationship of cervical cancer to genital herpes.
As an obstetrician gynecologist, I have been checking this problem now for approximately 6 or 7 years. And I will tell you that the papillomavirus that causes warts of the cervix is much more of a danger than the herpes virus relating to cancer of the cervix. However, I still recommend pap smears twice a year.
Yes, and that's true. They should be checked, and it's easily cured if caught early with the regular pap smear.
Thank you, Dr. Bryson, Dr. Eater. There's a great deal more to come on herpes, the complete story. When we come back, you're going to meet other members of the herpes virus family. So please stay with us.
Keep breathing deeply. I've got a cold, but it's not stopping me. Sudafed cleared my stuffy nose fast, without drowsiness.
Imagine doing that with a cold. A little while ago, my nose was stuffed up, but I got fast relief with Sudafed and no drowsiness.
How fast will Sudafed work for you? Clinical tests show Sudafed begins to unclog nasal congestion in as quick as 22 minutes without drowsiness.
With Sudafed working, I can finish my workout.
Sudafed. Relief begins in 22 minutes without drowsiness.
Believe me, suffering cold symptoms in one of these, 120 miles in space, with no doctor in sight, it was no picnic. My nose was stuffy, sinuses plugged, I was miserable. So I took Actifed. And Actifed containing triprolidine gave me fast, effective relief. Actifed is the cold tablet that was specified most by doctors for 10 years for relief of nasal congestion, runny nose, and sneezing before being available over the counter. Try Actifed. It's the same strength I used in space. Available to you without a prescription.
Every weeknight, Lifetime talks to you. Starting at 7 p.m. Eastern, everyone opens up to Regis Philbin.
You know, I think I was a sex pot.
Then at 8, join Richard Belzer for Hot Properties. Hear from the hottest tickets around.
When I came on the scene, it wasn't in the rock and roll. It was swing and sway with Sammy Kaye. I couldn't swing and I couldn't sway, so I rocked.
Next at 9, Stanley Siegel puts his guests in the hot seat.
You made a career out of this.
No, I haven't made a career out of it.
Do you enjoy doing these kind of pictures?
I enjoy making pictures, and I see nothing wrong with nudity, but I don't make nude pictures.
And then at 10, Dr. Ruth tells it like it is.
You have 60 more years of good sex ahead of you.
So I'm not hopeless.
Absolutely not.
So tune in every weeknight starting at 7 p.m. Eastern for Lifetime, America's first talk television network.
This program is produced by Lifetime in cooperation with the Centers for Disease Control and is sponsored by Burroughs Wellcome Company.
Lifetime presents Herpes, the complete story, an informathon about a national health problem and its control, with reports from Atlanta, Seattle, Birmingham, Alabama, and Los Angeles, plus live satellite interviews with medical experts at the U.S. Centers for Disease Control, featuring as your hosts Joseph Benty and Glenda Weena. Here again, Joseph Benty. Welcome back to Herpes, the complete story. Occasionally, over the next hour, we're going by satellite to Atlanta, the headquarters city for the National Centers for Disease Control.
Joseph, you know, the CDC is where some of the nation's leading researchers keep tabs on diseases like genital herpes. We'll be going there soon to meet Dr. Ward Cates, Director of the Division of Sexually Transmitted Diseases, and Dr. Mary Guinan, Associate Director of External Relations. But first, we remind you again that we will be taking some telephone questions on the air live, so do call the number on your television screen if you care to give it a try.
Herpes viruses are like obnoxious relatives who come for a visit, but forget to leave. Once herpes viruses move in, they are with you for life. They're usually dormant, but they're extremely common and sometimes make it uncomfortable and troublesome. We've already met 2 members of this troublesome family, herpes simplex 1 and 2. Beth Cavanaugh in Birmingham, Alabama, introduces us to 3 more, starting with the one called cytomegalovirus.
Researchers here at the University of Alabama at Birmingham have been studying the herpes family for years. The one they found the most puzzling is cytomegalovirus, or CMV. It is widespread but not well understood. The virus is commonly transmitted by direct contact, usually kissing, and the infection normally causes only mild symptoms: sore throat, fever, fatigue, swollen lymph glands, if it causes symptoms at all.
Most infections with this virus are totally, completely unrecognized by the patient, by the physician, etc. No symptoms whatsoever. It's a very, very common infection, but very uncommon disease.
While the virus in most people is relatively harmless, it can be devastating in rare cases. A pregnant woman infected for the first time with CMV may transmit it to her unborn child.
Of all the children born with infection, however, only about 1 out of 10 is truly symptomatic. So really about 1 out of 1,000 deliveries, the child will show severe evidence of disease. It's those children in particular who are at risk for high-frequency hearing loss and even death as a consequence of congenital CMV infection.
Because of birth defects caused by CMV, researchers here are concerned about the growing spread of the virus among preschool and school-aged children. They're studying how CMV is transmitted among children at a group daycare center. It is not highly contagious, not airborne like some viruses. Infection may require close contact over an extended period, possibly with urine or saliva. The children themselves may never become ill, but there's a greater danger.
If large numbers of preschool-aged children begin to acquire CMV, since children this age usually shed virus for years after they acquire it, they could create a pool of individuals who could provide a source of exposure for young women having families. Probably the mothers of these children, perhaps daycare workers.
The other members of the herpes family are varicella zoster, which causes chickenpox in children, and shingles in adults, and a virus labeled Epstein-Barr, a name less familiar than its infection, mononucleosis, or kissing disease, which most people acquire by the time they're ready for college.
I think it's fair to say that if we look at all of these diseases, that the individuals who have varicella zoster virus or cytomegalovirus or herpes simplex infection really do quite well in society unless they have a life-threatening form of infection like herpes simplex encephalitis or neonatal herpes, where there is risk for brain damage.
Modern medicine is now making it easier for our families to learn to live with the herpes family of viruses. Our knowledge and understanding of these common organisms will enable us to accept living with herpes as a part of the human condition. This is Beth Cavanaugh reporting for Lifetime in Birmingham, Alabama.
We'd like to emphasize that even though CMV is very common, it is also innocuous for the most part. It causes no problems except during pregnancy. Now, let's focus on the varicella zoster and Epstein-Barr viruses with the help of Dr. Nathaniel Brown, Assistant Professor of Pediatric Infectious Diseases at the UCLA School of Medicine. And by satellite from Atlanta, Drs. Mary Guinan and Dr. Ward Cates of the CDC. Now, first, Dr. Brown, what is the latest you can tell us about treatment of chickenpox?
Well, there are actually 2 effective drugs or medications that can be used to treat severe chickenpox. For the most part, these are reserved for children who have debilitating disease and who might contract serious or even fatal chickenpox. And these drugs are Ara-A and acyclovir.
And they're showing great promise.
Yes, Ara-A has to be used by vein, whereas acyclovir can be used by vein or there's an oral form, as we've already seen on the program.
Okay. Dr. Guinan in Atlanta, could you explain briefly the connection between chickenpox and shingles?
Well, shingles is a reactivation of the chickenpox virus. It is not a new infection. It's the same old chickenpox virus that we had as a child. It's just a reactivation. What causes the reactivation is unclear. Some people will never have a reactivation. Once a reactivation occurs, usually it will never occur again.
Okay, thank you, Dr. Guinan. We're going to be going to Dr. Guinan and Dr. Cates frequently throughout the rest of the broadcast. We have a telephone call now from Ann in Los Angeles on this subject. Ann, your question?
Yes, I'd like to know if there's a connection between having mono as a teenager or young adult and developing a more serious disease at a later time in one's life. And if so, does the severity of the case of mono make a difference?
Want to take that one, Dr. Brown?
Sure. Dr. Bryson alluded earlier to the fact that there's been 2 recent reports describing a syndrome of chronic fatigue. These people also occasionally complain of intermittent sore throat and fever. Sometimes they have tingling sensations and other neurologic complaints.
Okay.
This disorder needs to be really borne out by further studies before we can say for sure that it is caused by Epstein-Barr virus, and further studies will be underway, I'm sure.
Dr. Cates, I'm not going to let you sit there without throwing something out to us. What can you add to this?
Well, basically what we really have to emphasize is that the chickenpox is a member of the herpes family, but is not herpes per se. It's as simple as that.
And later in life, it can come back to haunt you in another form.
Exactly.
Okay. As I said, we're going to go back to Dr. Guinan and Dr. Cates throughout the rest of the broadcast. But Dr. Brown, I want to give you a quick question on the Epstein-Barr virus, as we have identified it as the usual cause of mononucleosis. Is there anything else that it is implicated in?
Well, we just talked about one disorder of chronic fatigue, which, as I said, needs to be borne out by further research. There was a lot of excitement when this virus was first discovered in a certain kind of tumor in African children, and it still carries quite a bit of believability as a tumor virus in certain very limited circumstances, which generally are not a big problem in the United States, but in Asia and Africa it may be a cause of certain kinds of relatively common, or may participate in the evolution of disease of 2 kinds of tumors in those countries.
Okay. Thank you, Dr. Brown, Dr. Guinan, Dr. Cates. Time now for another break, but please don't go away. There's much more ahead when Herpes, the complete story, continues.
I'm Dr. Linda Reed in Los Angeles. There are a lot of myths surrounding herpes and pregnancy. I'll give you the facts when we come back.
Morning, Rob.
For more than 75 years at Burroughs Wellcome, people like Lynn Elwell have committed their time and energy to pharmaceutical research. And Burroughs Wellcome supports that commitment. Most of the company's profits are given back to research aimed at relieving human suffering and disease. At Burroughs Wellcome, dedicated people are providing important new treatments and medications.
What we need to do as a team is to discover innovative new medicines that will have significant benefits for people, and then develop them and provide them to people more rapidly and at a lower cost.
More than 30 years ago, a team of researchers started the search for new ways to fight viruses. The result of their hard work and dedication was the first effective drug for the management of genital herpes. Now, we're continuing to explore treatments for the entire family of herpes viruses. Research, people who care, products that make a difference. The hallmark of Burroughs Wellcome's past and the foundation of our future.
In the pursuit of knowledge about genital herpes and how to control it, Americans owe much to early research done overseas. Around the time of World War I, German physicians first suspected and proved a connection between genital herpes and a virus. In the 1930s, key discoveries about how that virus works were made in Australia. There, Doctors Macfarlane Burnett and Stanley Williams became the first to recognize the recurring nature of genital herpes. Thanks to such insights from abroad, American medical science was better prepared to deal with the disease when it began to flare into a major health problem here.
Of all the possible consequences of genital herpes, its potential effect on newborn babies is probably the most serious. But again, fact is often obscured by myth. Dr. Linda Reed dispels the widespread notion that women with genital herpes should not try to have children.
Bill and Lauren McGee always looked forward to having children, and 3 months ago their dream came true when Michael was born. But adding to the normal stress of pregnancy was the fact that Lauren has genital herpes, a problem that presents a risk for the newborn.
Well, the only thing that I had heard before was that the child could be born with the infection maybe in their eyes or their nasal cavity, and that and the worst fear was, of course, that they would contract infection so bad that they would die from it. It really frightened me.
Lauren had reason to be concerned.
An active genital herpes infection can indeed be transmitted to the baby during delivery as it passes through the birth canal. Sometimes the results are tragic.
If they get an infection, they can have either a disseminated form, which is the most severe form, and there's a high death rate if they're not treated, like 70%. The other forms they can get is simply like a meningitis or a form that infects the brain, and they may just remain with localized skin lesions only, or just in the eye or in the mouth. There's quite a range of severity.
Complicating the problem is that genital herpes is often asymptomatic. Most women whose babies develop the virus don't even know they have it.
About 75% of women have no history of herpes, and most of them have no lesions at the time of delivery. So the infant is born with neonatal herpes, and it comes as quite a surprise to the mother. And often, that's when herpes in the mother is diagnosed because the baby has it.
Of course, many women with the virus worry about the potential complications. But fortunately, neonatal herpes is rare, so most of the worry is unnecessary. What are some of the common myths that women have about herpes during pregnancy?
Well, I think many do feel that they can't have children, or that their children will have some kind of birth defect, or that it's extremely likely that their baby will catch herpes, or that they're absolutely certain to have a cesarean section.
Despite the potential risks and complications, most pregnant women with herpes deliver healthy babies and do not have to undergo a cesarean section.
Women who have recurrent herpes only need to have a cesarean section about 30 to 33% of the time. About 70% of the time they can safely deliver vaginally. If they don't have lesions, if they don't have prodrome, and if the cultures have been negative, then she can safely deliver.
How long have you had herpes? I'd say about 3 years.
In fact, with proper prenatal care and counseling, most cases of neonatal herpes can be prevented, and the McGee family is a testament to that. Lauren was screened for herpes throughout her pregnancy, and she delivered normally, a healthy baby boy.
Everything's over so terrific, and I love being a mom. And he's absolutely wonderful, and he's incredibly healthy.
I'm Dr. Linda Reed for Herpes, The Complete Story.
As Dr. Reed pointed out, neonatal herpes is rare. Fortunately, only about 500 cases reported annually. But because the consequences can be so devastating, precautions against it do become vitally important. Again, our medical advisor, Dr. Yvonne Bryson. And by satellite from Atlanta, Dr. Mary Guinan of the Centers for Disease Control. Dr. Bryson, first, we've already heard women who know they have genital herpes should be carefully monitored. But what about women whose partners have genital herpes, but who so far do not appear to have had it themselves?
I think that's a very important point in that we believe that women whose husbands or partner has herpes should be followed as if they have herpes. This is because still a lot of the babies born are born to mothers who are asymptomatic. So I think by being monitored, this will prevent the possibility of disease.
How often would they be monitored?
They'd be monitored similar to another woman, which is approximately weekly during the last 4 or 5 weeks of pregnancy.
Thank you. And in Atlanta, Dr. Guinan, I understand that you have a comment to make not only on neonatal herpes, but also on neonatal cytomegalovirus.
I think I'll start with the neonatal herpes infection. I think that it is very true that the large majority, the vast majority of women with genital herpes have normal, healthy babies and have vaginal deliveries, and I think that's the message. Once you know you have genital herpes, it can be managed, and that's a very important health message.
Thank you very much, Doctor. We do have a telephone call. It's not on the subject, but it is from Linda in Houston. Linda, please address your question to the doctors.
I noticed on your graphic that herpes can be contagious prior to the outbreak of the actual lesion. How can this be transmitted this way?
Basically, when you have prodrome symptoms or when you feel like a herpes attack is coming on, as we've talked about earlier, this can also be a contagious period. So we advise people not to have sexual contact during the period of prodrome as well as the time they have lesions. In between episodes, it is relatively safe, so that the virus is really present and contagious for the most part during the actual outbreak.
Thank you very much, Dr. Bryson. You know, Dr. Guinan, one other question for you. Should women with genital herpes breastfeed their babies?
Yes, There is no medical reason why a woman with genital herpes shouldn't breastfeed. In fact, that's, I think, an appropriate thing to do.
And a very good answer to go out on, and thank you both doctors. Let's get back now to Joseph Fenty for a look ahead and a herpes IQ question. Joseph.
Okay, thank you, Glenda. After we take a break, we're going to hear how some teenagers feel about herpes. But our first order of business, another quiz question for you. How many different types of herpes can you identify?
Maybe 10 different types?
Oh, 2 or 3, I imagine. Probably at least a dozen.
About 5, I guess. I don't know. 10. Probably 10. One would be a coastal, which is a form of herpes.
It's like 1, 2, herpes zoster. That's only 3 that I know of.
Remember, keep breathing deeply. I've got a cold, but it's not stopping me. Sudafed cleared my stuffy nose fast, without drowsiness.
Imagine doing that with a cold. A little while ago, my nose was stuffed up, but I got fast relief with Sudafed and no drowsiness.
How fast will Sudafed work for you? Clinical tests show Sudafed begins to unclog nasal congestion in as quick as 22 minutes without drowsiness.
With Sudafed working, I can finish my workout.
Sudafed. Relief begins in 22 minutes without drowsiness.
Because your family is like no other, it needs its own personal approach to health. Family physicians are dedicated to your well-being and want each of you to share information that affects your health. Conditions like high blood pressure may require lifelong medication, but if you can't remember dosages, your doctor may be able to prescribe medicine to take just once a day. So communicate openly with your doctor. America's 60,000 family physicians can help you focus in on health.
Studies have shown that teenagers comprise the second highest risk group for sexually transmitted diseases. That being the case, we thought that it might be interesting to drop in on a group of high school students who are discussing the problem of sex and genital herpes.
To become an adult, you have to be responsible.
Right,
and if you're not responsible for your actions when, say, you're 16, 17, or 18, then, you know, it'll be harder to grasp later.
And I think that we now need to look at this new incurable disease called herpes.
I've heard that it's only contagious.
When it's active.
When it's active.
And when it's active, you definitely know that you have it.
Yeah, it's not like cancer. When somebody gets cancer, you say, oh, that's so sad.
Their embarrassment to tell somebody else, hey, I have this disease, and I think I should be careful and let you know in advance.
But it's scary. You know, it's something you have the rest of your life.
Those are students at Fairfax High School in Los Angeles. They're members of a special class that's learning to counsel other students about adolescent problems. Their teacher, Lee Saltz, is here with us now. And Ms. Saltz, we hear a lot nowadays about teenagers being more and more cautious and conservative. From your perspective with those students at Fairfax, is that an accurate statement? Conservative, cautious, wary?
Well, I think that probably in any urban high school you'd find about 50% of the students are sexually active. Adolescence is a very difficult time in terms of postponing anything. One of the big problems we have when we discuss postponement of anything is how. And for a student who's very responsible, they are going to be very, very cautious. For the ones who are not responsible and need an immediate gratification, it's a very difficult thing to ask them to postpone something that they want now.
Americans by region traditionally have always had problems with sex in the schools, sex education, a controversy in many communities. Do you find that sexual knowledge at the age of high school is an important
uh,
uh,
antidote to possibly making the mistakes that lead to herpes?
antidote to possibly making the mistakes that lead to herpes?
Well, I think that
I believe sex education is very important. I wish it were started earlier. They do have some in Los Angeles in the 7th grade, but not too fully. And by the time I get them in the 10th and 11th grade, we have a number of students who have become sexually active already. Our main thrust right now is to help them make good decisions, to diminish the risk-taking, and to become responsible adolescents and hopefully responsible young adults.
Thank you, Ms. Saul. When we asked Ms. Saul students if they had any questions that they wanted to ask any of our experts, we got some of those questions recorded on videotape, and we have the experts standing by now with some answers. So let's have the first question, please.
If a person has herpes and they show no visible signs, is it still possible to contract the disease?
Dr. Cates, Dr. Guinan, Dr. Bryson, who wants to answer that?
Why don't I take this one?
Sure.
The answer is yes, it is still possible to contract it. And what we need to tell people is to be honest, to communicate the way Dr. Ruth said to. And a study done by Mary and colleagues showed that up to 2/3 of genital herpes is transmitted by people who don't have any symptoms.
Thank you, Dr. Cates. Our second question from Fairfax High School.
When the virus is active, what is the effect on the general health? I mean, if you're a healthy person and the virus is active, is your health affected so far as you get flus more often, coughing, etc.?
Dr. Bryson?
Really, in terms of general health, there should be no effect on the general health, other than we advise people who have herpes, as with any other disease, to stay healthy and have good diet, nutrition.
Back to Fairfax High, and another student and another question.
I've heard that herpes, the virus, can live on a doorknob or on a damp towel for 72 hours. I was wondering what kind of risk you're taking then, since that's been proven.
I'll go back to Dr. Bryson quickly because, as we said earlier, that part of that study was done at UCLA.
Right. It's very unlikely that one would transmit it that way. It's mostly by sexual contact or close contact, as we said. Basically, it's just good hygiene, hand washing, etc., and that's what's most important.
A person with herpes using towels, bath equipment in a home as a guest or a member of a family, should they be extra cautious, and should the host family be extra cautious?
I think that the family should use their own towels for individuals when they have an active outbreak, and they should wash their hands, etc., using good common sense.
All right, one more question now from Fairfax High School in Los Angeles. Our students, question.
I've heard that acyclovir can really cure herpes, and I know it might be a rumor, but what's going on with that? Is it really going to help?
Dr. Guinan, your turn.
Yes, acyclovir can help some people, but it's a small proportion of the whole herpes population. Some people with herpes really don't need this kind of medication and can do very well without it. I would like to say one thing about herpes from towels, catching herpes from towels or toilet seats. There's never been a case of genital herpes traced to a toilet seat or to towels or to any other inanimate surface. So I think that worry really should not be something to worry people.
Dr. Cates, while I have you here, and I know how you follow all of the research in these areas, what is the prospect for some kind of breakthrough in this area of viral diseases that may affect our knowledge of and perhaps future treatment, immediate future treatment of herpes?
Well, you've had the breakthrough discussed tonight. It's been the acyclovir, and this is a major breakthrough for ease of administration and for preventing recurrences. My quick quip also to pick up on the toilet seat or even the hot tub, which was fashionable lately, is you're not going to get it from the tub per se, but rather with what you might be doing in the tub.
Right. Thank you, Dr. Cates. And our thanks to Ms. Saltz for not only what you brought with you tonight in terms of your information, but your students and their questions, and Dr. Bryson. And we'll be going back to Dr. Cates and Dr. Guinan in Atlanta a bit later, but now let's go back to Glenda Weena. Glenda?
All right, Joseph, in the next half hour, we're going to hear some valuable advice on coping with genital herpes. In the meantime, though, we're going to hear from Dr. Linda Reed, who's been keeping track of our viewer telephone calls.
We have been busy over here, and if you haven't tried calling in yet with a question on herpes, here's the toll-free number, 1-800-828-LIFE. That's 1-800-828-LIFE. Our experts are standing by. If you have tried and the lines are busy, please don't give up. We're going to take as many calls as we can while we're on the air. Now let's talk to another volunteer expert.
Sure.
Doctor?
Just 1 second, please.
What have callers been asking?
An important question has been, how did I acquire this disease? In many instances, the disease has been acquired from a spouse. But it's not uniform. Not all cases have been acquired by sexual transmission. In some cases, people have accidentally inoculated themselves by transmission of the herpes virus from the mouth to the genital area. Another common way is people having had this disease 5-10 years previously. And now they have an established relationships or monogamous relationships. They make love, and they acquire the disease, what they think of the first time. This is not the case. This is a reactivation of the disease that has remained latent in the body for many, many years.
Thank you. Let's see what other questions we have. Doctor, if you could put your caller on hold, please.
Can I put you on hold just a minute or so?
Okay.
Thank you.
What have patients or callers been asking you?
Well, there's a whole spectrum of questions that people have been asking. One of the most common questions that the women have been asking is, if they have herpes in the vagina, how do they know? And that's not an easy question to answer, because very often it's asymptomatic when it's in the vagina, and you don't know that you have it. If you have some symptoms, then it shows up, but it may not show up.
It's important to keep that in mind. Thank you. If you have genital herpes and you're finding it difficult to cope with, don't go away. We'll have some helpful information when Herpes, the Complete Story, returns.
For the American Academy of Dermatology, Dr. Ronald Reisner. Dr. Reisner, how does a dermatologist go about diagnosing herpes infections?
Most herpes infections involve the skin, and dermatologists, as physicians with specialized training in the diagnosis and treatment of skin diseases, are often called upon to determine whether an eruption is herpes or not. Herpes may involve any part of the skin and may mimic other eruptions such as impetigo and shingles. Accordingly, the physician has to follow a logical series of steps to arrive at the correct diagnosis. Sometimes the history of the eruption and the way it looks is enough to arrive at the correct diagnosis for practical purposes. Other times, specialized laboratory tests such as scrapings and cultures are necessary. In any event, accurate diagnosis is the first important step in the treatment of this troublesome disorder.
Remember, keep breathing deeply. I've got a cold, but it's not stopping me. Sudafed cleared my stuffy nose fast, without drowsiness.
Imagine doing that with a cold. A little while ago, my nose was stuffed up, but I got fast relief with Sudafed and no drowsiness.
How fast will Sudafed work for you? Clinical tests show Sudafed begins to unclog nasal congestion in as quick as 22 minutes without drowsiness.
With Sudafed working, I can finish my workout.
Sudafed. Relief begins in 22 minutes without drowsiness.
Believe me, suffering cold symptoms in one of these, 120 miles in space, with no doctor in sight, it was no picnic. My nose was stuffy, sinuses plugged, I was miserable. So I took Actifed. An Actifed containing triprolidine gave me fast, effective relief. Actifed is the cold tablet that was specified most by doctors for 10 years for relief of nasal congestion, runny nose, and sneezing before being available over the counter. Try Actifed. It's the same strength I used in space. Available to you without a prescription.
This program is produced by Lifetime in cooperation with the Centers for Disease Control and is sponsored by Burroughs Wellcome Company.
Broadcast, we're trying to explode the myths involving herpes, and one of the cruelest of those myths is that its victims become outcasts, abandoned by friends and loved ones, deprived of social relationships and, of course, emotional support. People with genital herpes may indeed have to make certain adjustments, but they don't have to go it alone, as we hear in this report from Mary Armentrout about one woman who chose to remain anonymous.
Most people who have genital herpes say it's not the physical discomfort, but the psychological discomfort that's the worst.
Just the feeling that, oh no, it's happening again. I must be a terrible person for having this happen. What did I do to deserve this? And then what I tend to do is I tend to withdraw.
When Kay, which is not her real name, first discovered she had genital herpes, she was devastated. Now she is on medication, acyclovir, and has fewer outbreaks. But possibly the most difficult area for a person who has genital herpes is what to tell people.
If you find yourself in an occasion to have sexual intimacy with someone, do you tell them that you have herpes?
Guess it depends on the situation. Certainly, it depends on whether or not I'm having an outbreak. I'll tell you this, though, that no one that I have told that I've had herpes has ever rejected me because of that.
When there are uncertainties, it's helpful to remember that there is help available. The Herpes Resource Center is located in Palo Alto, California, and is a national center which conducts and operates research, publishes information on medical and psychological aspects of the disease, as well as the current updates on new drugs. It also operates self-help groups around the country.
It's simply a matter of educating people, sitting down and erasing their concerns, erasing the myths, and replacing those with accurate information and facts. That's the first step in really starting to address people's concerns and getting them to deal more effectively with herpes.
The center also operates a toll-free hotline, which receives 70,000 calls a year. If you need some help or information, the hotline is available. In California, call 1-800-982-5883. For the rest of the country, call 1-800-227-9822. The simple message of the Herpes Resource Center is that life with herpes can be just fine.
I think the biggest misconception is that once you get it, your life is going to be destroyed, that there's no way to deal with it, and that you might as well just chalk it up. And that conception has been placed in people's heads, and what we try to do is teach them that there is, quote, life after herpes, that there's ways of dealing with it.
Help is available, and for many it has changed the concept of being a person afflicted with herpes. I'm Mary Armentrout reporting for Herpes, The Complete Story.
No matter how much you hear about herpes or how much you're told in a television broadcast, there is one good way to understand what's going on, and that's to read about it yourself. We'd all like to see it so that we can read it and find out what the facts are for ourselves. So the Burroughs Wellcome Company is offering this free booklet to all of our lifetime viewers. For a copy for yourself, just send a self-addressed stamped envelope to Herpes Booklet, Post Office Box 880, Hillsborough, North Carolina, to zip code 27278. That's Herpes Booklet, Post Office Box 880, Hillsborough, North Carolina, to zip code 27278. Now, let's go back to Glenda Weiner for some advice on how to cope with genital herpes. Glenda?
Thank you, Joseph. You know, people with genital herpes often develop emotional problems, too, and those may be harder to cope with than the disease itself. We have with us Dr. Anna Heinrich, Dr. Anna Heinrich, I should say, who is a clinical psychologist at the Institute for Sex and Marital Therapy in Los Angeles. And Dr. Mary Guinan and Dr. Ward Cates are also standing by in Atlanta. Dr. Heinrich, first to you, what are the most common problems that people seem to develop psychologically as a result of having herpes?
Well, I think we should begin by saying that not everyone has problems when they recognize that they have herpes, that we all differ in how well we cope with life's problems, and that person may be more or less able to cope depending on the other stresses in his or her life. But when they do have problems, they seem to be problems of a threatened self-image that leads to a sense of less well-being, diminished sense of self-esteem.
I'd like to ask Dr. Guinan and Dr. Cates in Atlanta, or Dr. Guinan, would you comment on this also? The most common kinds of psychological problems one seems to see in people who have herpes.
Yes, well, I think many of them are because of the negative press. The media has perhaps brought a message of doom with genital herpes, and that is incorporated by the patient, which causes, obviously, some psychological problems. And I agree that it is the minority of patients that have these problems, but we do have to deal with them.
All right, thank you very much, Dr. Guinan. You know, we do have a caller on the subject. Her name is Kara. She is from West Hollywood. And Kara, please address the question to our experts.
Okay, this is sort of a two-part thing. First of all, if you can have an outbreak that is as small as one tiny little lesion on your cervix, you wouldn't even know about it, And second of all, there appears to be some kind of new research that condoms don't actually protect against it, that the virus itself is too small. It's small enough to pass right through the rubber. So with both of these things, how can you ever feel safe or sure or comfortable having sex ever again?
Dr. Guinan, I think you'd better answer that question.
Yes, I think that there's some misinformation there. It is not true that herpes passes through condoms. The condom is a very effective barrier for herpes viruses. And it is true that women who do not know that they have lesions or perhaps shed virus may transmit infection, but they can protect themselves. There are ways to protect themselves and to protect their partners, and one is by the use of condoms. Condom in a partner can protect against transmission of herpes virus. Also, the use of a barrier method by the woman, a use of a diaphragm with spermicide, will probably reduce the transmission to her partner. Also, will protect the woman from acquiring disease.
Thank you very much, Dr. Guinan. Thank you very much, Dr. Heinrich. We're going to take time out now, but first, another quiz question to test your herpes IQ. When did the first case of herpes occur?
The first case of herpes.
I'm sure it's been ages ago, but nobody really knew what it was.
So something happened when Columbus came to America, didn't it?
I believe it was a year and a half ago.
The first case of herpes was in earliest recorded time, Byzantine or Greek, whichever was first.
Well, I've heard it's been around a long time, but it's much more prevalent probably because those sexual mores have changed so much in our society.
Greek, early Greek, Atlantis.
People who care. Products that make a difference. The hallmark of Burroughs Wellcome's past and the foundation of our future.
Remember, keep breathing deeply. I've got a cold, but it's not stopping me. Sudafed cleared my stuffy nose fast, without drowsiness.
Imagine doing that with a cold. A little while ago, my nose was stuffed up, but I got fast relief with Sudafed and no drowsiness.
How fast will Sudafed work for you? Clinical tests show Sudafed begins to unclog nasal congestion in as quick as 22 minutes without drowsiness.
With Sudafed working, I can finish my workout.
Sudafed. Relief begins in 22 minutes without drowsiness.
Myths that linger through history need to be punctured too. Consider poor Christopher Columbus and his men. For nearly 500 years, it's been widely believed that when they discovered the New World, they also discovered a new STD, syphilis. In fact, this disease existed in Europe long before Columbus set sail. Although it's true an epidemic broke out around the time of his return to Spain, historians now agree it was simply a coincidence.
Hysteria about anything often produces ugly results. The recent herpes hysteria was no exception. At a number of schools around this country, children with the herpes virus became the targets of angry protests. They were based largely on ignorance and the myth that herpes is always something that should be feared. Ken Gale gives us a case in point.
Child's coming into the school here with this CMV, as they call it, and everybody else seems to think it's not that great of a deal, but I've got two children here, and I'm not going to take chances because I don't know that much about it myself.
Out of such fear of the unknown, parents of nearly half the students at the Ethel Phillips Elementary School in Sacramento, California, pulled their children out of classes last January. Some of those children were then sent to picket the school along with their parents. They were afraid of a handicapped 4-year-old boy with congenital cytomegalovirus infection who had just been enrolled. The furor began after a pregnant teacher expressed concern about having the child in her classroom. A legitimate concern, even though the risk to the woman's fetus was not great, says pediatrician Eli Gold, a longtime researcher into CMV. But Gold also says there was no reason for parents to be worried for their children.
The virus does spread very quickly, very easily among the kids, especially the younger kids who put toys in their mouth or share food, et cetera, et cetera. But again, we're back to the situation that almost in all situations, CMV infection is not accompanied by any significant illness. So the risk to the child is very, very small. It's insignificant in comparison with the risk for the pregnant woman.
Gold believes media coverage may have inflamed the situation, at least in the beginning.
Yeah, I think it did. I think the earlier reports, at least the headlines, were very misleading. I think that as the story went on, more and more information came out, and it was a bit more accurate.
Medical reporter Jeannie Asajian broke the story for her newspaper, the Sacramento Union.
I don't think it was blown out of proportion at all. And I think that we helped to explain things to those who weren't already hysterical.
Part of the problem, Asajian believes, was that local authorities were slow to react to the hysteria. And when they did try to reason with parents, their initial explanations were too technical and confusing.
I have two that are out, and it's hard to explain to your children why you have to keep them out.
I think I will take my children back into the school, but I am not going to give up picketing.
Today, 6 months later, things are back to normal here at the Ethel Phillips School. The child with CMV is in class, and Principal Jean Nix says everything is just fine now. But she admits to being somewhat concerned that reports like this may arouse the sleeping dog, worried that herpes hysteria has not been laid completely to rest. In Sacramento, I'm Kenneth Gale for Herpes, The Complete Story.
Now, Ken is back in the studio with us to talk about the broader issue involved here, media reporting of health stories in general. Is the coverage responsible? And if it is not, why isn't it? We're also going to be joined by Dr. Shirley Fannin of the Los Angeles County Health Department, and in Atlanta, Dr. Ward Cates of the CDC. Ken, on a scale from 1 to 10, how much responsibility in Sacramento do you lay on the doorstep of the press?
I think in this case about a 3, and it's partly because the local authorities didn't take into account the media and the role that they could play in explaining things to the population.
So you're blaming the local authorities more than the media?
Yeah, although what I found was Jeannie Asajian, the medical reporter who broke the story, found out about it because she had a friend who had a child in that school. And her friend was not upset. She just wanted to know more about it. So Jeannie went to a meeting and she found out more about it and broke the story. Well, fortunately, she's a medical reporter, so she did a pretty good job of getting the facts right, I think, as I understand it anyway, at the beginning. So it set a tone, I think, that I gather anyway from my talks with other people, including some of the health authorities up there, that the story actually was reported fairly well. There were some headlines that maybe they said were inflammatory. Reporters agree with that. Jeannie agrees with that, too.
Dr. Cates in Atlanta, I know you have some feelings about this story and press coverage in general. So what do you have to add to this?
Well, I'd say nationally, I'd rate it more like a 9 in terms of responsibility of the press, and it mostly has to do with, as Dr. Gold says, it's the headline writers. They have to be very responsible. If you dig into the story, you can find the facts. But the headline writers are the ones that get everybody inflamed. So in that regard, I think the press has to be very, very careful when it comes to anything sensational, especially involving an STD and a loaded word like herpes.
Sexually transmitted diseases and the CDC, the Center for Disease Control in Atlanta, spend a great deal of time with the press. Do you have any quick recommendations the public can do something about?
Well, basically, I do feel also that the medical profession has a responsibility. They have to make themselves available, as Ken implied, and they also have to transmit accurate information. Dr. Fannin, being one of the people who is most available to the press, I'm sure has other ideas.
I know Dr. Fannin and I have exchanged many stories, and a lot of information came from your office over the years. How do you deal with the press? What's the best way to handle them?
Well, the press is interested in news, and we're interested in health education. And I think I try to educate the press so that they understand what I think the issues are when I'm trying to get across. I also try not to be too technical, because we physicians have a great tendency to med-speak, and the general audience has a hard time understanding. Herpes is complicated, but not if it's explained in a reasonable way.
Do you then follow up? Politicians love to follow up. They'll call a reporter after a story has been reported. Do you call and say, I didn't like that, you were wrong, you didn't report it clearly or objectively?
I do, if something was incorrect,
I tell them so they won't make the same mistake. But I really don't berate the press because I find it really does no good. And usually you have a chance, if it is a good story, to correct wrong impression.
It's awfully hard, as I'm sure Ken will agree, to be able to go back and pull the story back to where it was when it might have been misreported or over-reported, sensationalized. But Dr. Fannin, I have to cut you off now. Ken, thank you. Dr. Cates in Atlanta and Dr. Shirley Fannin. We're going to be back with more on herpes, including the search for a vaccine, right after this.
For the American Academy of Dermatology, Dr. Ronald Reisner. Dr. Reisner, what's the difference between skin infections with herpes and shingles?
Well, both herpes and shingles are caused by related viruses and have some features in common which may lead to some confusion. It's important to distinguish between them because their treatment and their outcome is different. Dermatologists, as physicians with specialized training in diseases of the skin, hair, and nails, are often called upon to help make that distinction. Unlike herpes, shingles often occurs in a band-like pattern, and rarely ever is there a second attack. Unfortunately, there is the risk, especially in people over 50, of long-lasting pain after the rash has disappeared. Early diagnosis and treatment can help prevent this. Diagnosis can often be made on clinical grounds, and occasionally special laboratory tests are necessary.
Remember, keep breathing deeply. I've got a cold, but it's not stopping me. Sudafed cleared my stuffy nose fast, without drowsiness.
Imagine doing that with a cold. A little while ago, my nose was stuffed up, but I got fast relief with Sudafed and no drowsiness.
How fast will Sudafed work for you? Clinical tests show Sudafed begins to unclog nasal congestion in as quick as 22 minutes without drowsiness.
With Sudafed working, I can finish my workout.
Sudafed. Relief begins in 22 minutes without drowsiness.
Because your family is like no other, it needs its own personal approach to health. Family physicians are dedicated to your well-being and want each of you to share information that affects your health. Conditions like high blood pressure may require lifelong medication. But if you can't remember dosages, your doctor may be able to prescribe medicine to take just once a day. So communicate openly with your doctor. America's 60,000 family physicians can help you focus in on health.
If you've missed any part of this program or want to let a friend know about it, Herpes, the complete story, will be repeated this evening at 11 Eastern and again on June 18th and 23rd.
One way to approach the genital herpes problem is to find a cure for it. Another way is to get the herpes virus before it gets us. Now, that's the approach a number of medical researchers are taking right now, trying to develop a safe and effective herpes vaccine. We have a status report from Vivian Rosenberg.
Doctors diagnose more than 500,000 new cases of genital herpes each year. As we've seen, there is an effective treatment, yet no cure. However, many scientists believe that the best way to prevent the spread of herpes is through a vaccine.
The vaccine is a substance which is derived from a infectious agent, usually, which is inactivated somehow and injected in a person and stimulates the person's immune response to form antibodies which will protect a person from subsequent infection.
Dr. Berman and his colleagues at Genentech are one of several research teams in the United States and Europe working on a herpes vaccine.
There's several different types of research that are being done. The first type is the use of an attenuated herpes virus. That is a virus that has been weakened and presumably will not be infectious or will cause latency, but which will stimulate the immune system to produce a response against the infectious type of virus. The second type of approach utilizes a completely different type of virus, which was previously used to vaccinate people against smallpox. That virus carries a part of the herpes virus in it and in a complex way stimulates the immune system to produce antibodies against herpes infection. And the
third way is to produce proteins from the virus in the absence of the virus.
A vaccine which is safe and effective that would prevent genital herpes would be a fantastic tool in our prevention and control of disease. If we could vaccinate people against herpes and prevent disease, we could control this disease process very adequately.
A major problem in developing a herpes vaccine is that the virus hides in nerve cells and can escape detection by the immune system. Animal experiments and some tests in humans are underway in all the centers working on this vaccine, but more work is necessary.
The big question is how far can you extrapolate from animals to people? And you don't know until you try.
It's clear there's a lot of promising work going on across the country in the search for a vaccine against genital herpes. And though researchers say we still have a way to go, their progress is encouraging. I'm Vivian Rosenberg for Lifetime.
That is good news. Vaccines usually take a long time to perfect, but at least it's good to know that the search for a herpes vaccine is on the right track. Joseph, back to you.
Thank you, Glenda. We'd like to go back to Atlanta for a moment. Dr. Ward Cates has something to add to our earlier CMV report from Alabama. Dr. Cates?
Well, basically, Joseph, just wanted to add that in the classroom, the risk of getting cytomegalovirus from an asymptomatic child is so large that the risk of getting it from someone who's symptomatic, around whom there have been a lot of precautions, is really very small. And so we have to emphasize that as the overriding public health message.
Shirley Fannin asked me to emphasize something else. She said, you know, there's a good side to all of the press coverage, too, that no matter how sensational it might be, in the long run, it rivets public attention on very important issues of public health. Would you agree with that?
I certainly would. I like the way she put it, that in public health we have a health education responsibility, and therefore adequate use of the press is our best ally.
And sometimes just going around cleaning up the messes afterwards helps get everybody informed.
To that extent.
Okay, thank you, Dr. Cates. Now, on the upbeat note, we'd like you to meet in person two people you met earlier in our broadcast, only you met them on videotape, Chris and Len Poirier. Now, Chris, I want to thank you and Len both for your cooperation, and I trust you had some soul-searching to go public with this and to share your own experiences so that we could all benefit from your first-hand experiences and perhaps fears that others have about going public. If you were talking to someone, Chris, who just recently was told they have herpes, what would you tell them?
Well, I just re-emphasize to talk to your doctor, listen to what he has to say, get as much information as you can, and then just don't worry about it.
How do you deal with, I think Dr. Ruth Westheimer tried to help, how do you deal with the honesty that seems to be the central core issue for a couple who are dealing with herpes? How do you get that honesty out and up of where it can be dealt with? You must have some feelings as you look back on it now.
Actually, as we said in the interview, Chris didn't tell me that she had herpes until we were some part into our relationship. And that was mostly because she did not know that you could transmit the disease unless you had actual symptoms. Now that that information is readily available, I think people should be more careful about that and just try and be as honest as they can. And hopefully the person they're telling will understand and not shy away from that relationship.
We're going to switch back to Atlanta to Dr. Guinan and Dr. Cates for about a minute of summation from your point of view, since you are probably closer to this in a general way from the national point of view than any of us. Dr. Guinan, Dr. Cates? Just some closing comments if you have any.
Well, basically, I think the type of attitude reflected by the couple we've just heard from is one of the most admirable. If we could get that type of informed public all around, we'd have much less to fear from the myths that have been going around, which we hope are the balloons that have been popped tonight.
Dr. Guinan, any comments?
Yes, I agree. I think that herpes is a very complex disease, and it doesn't lend itself to one-liners. It's a program like this in which lengthy discussion brings out all the problems and makes it clear what the disease is like and how we can deal with it, which is very important.
Thank you. From Atlanta, Dr. Guinan, Dr. Ward Cates at the Centers for Disease Control. I'd like to thank you, Chris and Len, for sharing your intimate secrets with us. and perhaps helping others, probably by the thousands, to understand that herpes itself is something that can be dealt with and lived with. And I hope you both have a long, happy life together.
Thank you.
The past 2 hours, we've tried to sharpen the focus on genital herpes and the other herpes viruses. We've tried to clear up the fuzzy misconceptions that leave millions of Americans frightened and confused. If you now see genital herpes for what it really is, a disease that is contagious but preventable, annoying but treatable, and above all, hardly ever serious, then we have done our job. On behalf of Glenda Weena and all of the physicians who have helped us and other experts making the show possible, I'm Joseph Bendy. Thank you for being with us.